Simple steps today for a stronger, safer, and more independent. What if I told you that a single medical decision after the age of 60 could quietly dictate whether you stay completely independent for the next 10 years or begin a slow, painful slide into chronic weakness, complications, and months of unexpected recovery? Most seniors firmly believe that surgery is always the ultimate, most decisive solution. If an area hurts, operate on it. If a joint wears out, replace it. But modern clinical research in geriatric medicine tells a vastly more complex story. While some surgical procedures truly restore vitality, helping you see perfectly again, walk without physical agony, or stabilize a dangerous heart defect, others, which are surprisingly common, offer far less actual benefit than aging bodies are led to believe. According to data from premier global medical institutions, thousands of older adults undergo invasive procedures every single year that fail to significantly enhance their long-term wellness. Meanwhile, other life-altering operations that could dramatically protect their physical freedom are delayed for far too long. Today, we are going to uncover the clinical truth. 3 highly common surgeries that many seniors should think twice about, and 3 medical procedures that could help you stay active, sharp, and self-sufficient for decades to come. Before we pull back the curtain on the first operation, if you want to safeguard your daily mobility and live autonomously as you age, please click that subscribe button below and turn on the notification bell so you never miss another senior health masterclass here on the Dr. Robert channel. If you are ready to make wiser, safer medical choices for your future today, please type 1 in the comments right now. If not, drop a 0 so I can learn how to optimize these health blueprints for you. Let's look closely at procedure number 1, spinal fusion for chronic back pain without nerve damage. It typically starts with a dull, nagging ache in your lower back that you quietly accept as a normal sign of getting older. It flares up after a long walk, while standing at the kitchen counter preparing a meal, or the moment you swing your legs out of bed in the morning. When physical therapy feels too slow, a specialist might suggest a powerful-sounding fix, spinal fusion surgery. To a senior, the word surgery sounds like a definitive cure. But here is the medical truth you are rarely told up front. Spinal fusion permanently welds 2 or more adjacent vertebrae together so they can never move again. In theory, this stops a painful segment from moving. However, your spine was anatomically engineered to function as a flexible, moving chain. When you permanently lock one link in that chain, the neighboring spinal joints are forced to absorb double the mechanical stress every time you twist, bend, or sit down. For an aging body, this often triggers a progressive cycle of adjacent segment degeneration. Furthermore, recovering from a spinal fusion requires months of severely limited mobility. That prolonged inactivity causes rapid muscle wasting around your core and hips, the exact structural stabilizers you require to prevent falls. Peer-reviewed orthopedic journals have repeatedly demonstrated that for age-related wear and tear, without direct nerve compression, non-surgical approaches like targeted core strengthening, posture reconstruction, and anti-inflammatory care yield identical long-term outcomes without the surgical risks. Rebuilding the natural musculature around your spine is almost always superior to permanently locking it in place. Procedure number 2, knee arthroscopy for age-related arthritis. This is one of the most frequently performed operations in the world, yet massive clinical trials show it often provides shockingly little benefit for arthritic knees. When your knee throbs after grocery shopping or gardening and an MRI shows structural wear, a doctor might suggest a quick, minimally invasive arthroscopic procedure to clean out the debris or smooth down rough cartilage. It sounds so simple, just a tiny camera, a few micro tools, and a couple of small incisions. But osteoarthritis is not caused by a single loose piece of bone that can be plucked out. It is a systemic, gradual thinning of the protective cartilage cushioning the entire joint. By the time you are in your late 60s or 70s, that wear is widespread, Scraping away microfragments does absolutely nothing to restore the lost fluid or rebuilding the missing structural cushion. Widespread clinical data reveals that structured physical therapy designed to strengthen the quadriceps provides pain relief that is equal to or even better than arthroscopy. Your quadriceps muscles act as your knee's natural biological shock absorbers. When you undergo surgery, the forced downtime actually weakens those protective muscles, frequently leaving the joint feeling even more unstable and vulnerable than before. Procedure number 3. Elective cosmetic surgery without medical necessity. This isn't about physical pain. It's about looking into the mirror after 60 and feeling like the drooping skin around your eyes or the lines across your cheeks don't match the vibrant energy you still feel inside. Wanting to feel confident is fundamentally human, but elective aesthetic surgery carries hidden physiological costs that older bodies struggle to clear. After age 60, dermal tissue becomes significantly thinner. Blood vessels grow more fragile, and the immune system responds slower. A routine outpatient procedure that a 40-year-old heals from in a week can cause months of severe swelling, prolonged scarring, or localized nerve irritation in a senior. The largest hidden variable, however, is general anesthesia. Older brains are highly sensitive to anesthetic compounds, which can trigger an unexpected medical condition known as post-operative cognitive dysfunction, POCD. This can leave an otherwise sharp, independent senior experiencing days or even weeks of distressing confusion, memory lapses, and disorientation after waking up. Unless an operation is medically vital, such as eyelid surgery, to restore a restricted field of vision, taking on systemic surgical risks purely for aesthetics requires profound hesitation. Now, let's shift our focus to the other side of the spectrum. These are the 3 structural procedures that can dramatically safeguard your quality of life and should never be ignored or delayed. Essential surgery 1. Cataract surgery. Many older adults gradually normalize fading vision. They crank up the brightness of their reading lights, hold documents further away, or slowly stop driving at night because incoming headlights cause a blinding glare. They chalk it up to just getting old. But cataracts, the progressive clouding of the eye's natural lens, do something far worse than blur your sight. They quietly destroy your independence. Diminished visual acuity and scattered light delivery severely compromise your spatial awareness. This directly triggers a dangerous chain reaction, drastically escalating your risk of life-altering falls on staircase steps or uneven pavements. Cataract surgery is mathematically one of the safest, most precise, and most successful procedures in modern medicine. In less than 30 minutes on an outpatient basis, the clouded lens is painlessly replaced with a crystal-clear artificial intraocular lens. Within days, colors saturate, facial recognition becomes effortless, and overall fall risks plummet. Restoring your sight instantly restores your psychological confidence to engage with the world safely. Essential surgery 2. Total hip replacement. One of the most aggressive thieves of senior independence is hip osteoarthritis. It begins subtly, a slight stiffness when exiting a car, or a slow hesitation when rising from a deep armchair. Eventually, the smooth cartilage wears away completely, forcing bone to rub directly against bone. The real danger here isn't just the localized joint pain, it's the systemic immobilization that follows. When moving hurts, you naturally sit more. Your glutes, thighs, and core muscles rapidly atrophy. Your walking gait alters, your balance degrades, and your daily world shrinks to the confines of a single room. When conservative metrics no longer manage severe hip arthritis, a total hip replacement is entirely life-changing. Modern orthopedic advancements have made recovery highly predictable and exceptionally safe. It completely removes the arthritic pain, allowing seniors to reclaim their natural stride, sleep soundly, and restore their systemic mobility. Timing is paramount here. Waiting until you are completely wheelchair-bound makes post-operative physical rehabilitation significantly harder because the supporting muscles have already withered. Talk to your surgeon the moment joint degradation begins cutting off your daily activities. Essential Surgery 3. Pacemaker implantation for rhythmical disorders. Some of the most lethal cardiovascular threats after 60 don't present with crushing chest pain. Instead, they whisper. You find yourself feeling completely exhausted just walking across the living room. You experience sudden, fleeting dizzy spells when standing up, or a brief lightheadedness that clears within seconds. These are classic clinical indicators that your heart's intrinsic electrical conduction system is failing, often resulting in a condition called bradycardia, where the heart beats too slowly to pump oxygenated blood to your brain. This creates a massive risk for sudden fainting episodes, leading to catastrophic, unbraced falls. A pacemaker is a miniature, highly intelligent device placed just beneath the skin near your collarbone. Its ultra-thin microwires continuously monitor your cardiac rhythm. If your heart pauses or drops below a safe threshold, the device instantly emits a gentle, imperceptible electrical impulse to maintain a flawless rhythm. The implantation is minimally invasive, performed under localized numbing and mild sedation, and most seniors return home within 24 to 48 hours. The physiological result is profound. Immediate cognitive clarity, restored daily physical energy, and absolute protection against syncopal balance loss. As we look ahead over the next 1 to 5 years, the clinical choices you make regarding your body will entirely shape the trajectory of your aging process. Growing older fundamentally alters how your organs, tissues, and brain process surgical trauma and pharmaceutical anesthesia. An operation that was a simple inconvenience in your 40s carries entirely different neurological and structural consequences after 60. The ultimate takeaway today is not that surgery is inherently good or bad. It is that the right procedure, performed at the exact right physiological window for the right anatomical reason, will save your independence. Conversely, the wrong, rushed procedure can introduce immense biological stress without fixing the baseline issue. Before committing to any irreversible surgical path, have an authentic, thorough dialogue with your physician. Ask about conservative alternatives, request data on full recovery timelines, and evaluate how the operation will realistically alter your daily functional living, not just what it looks like on an X-ray or an MRI scan. Knowledge is your ultimate shield against frailty. Please take a brief moment right now to comment below with your age and share one insight from today's guide that you plan to apply to your own medical roadmap. Smash that like button. Share this vital guide with a contemporary who is facing a surgical choice, and subscribe to Dr. Robert to protect your longevity journey. Thank you for watching. Analyze your options wisely, and I will see you in our next video.